Hello again, this is Dr. Tony D from Elev8 Chiropractic, and on this installment of Elevate You, we are tackling the age-old question that has plagued mankind for centuries. Should I use heat or should I use ice? Check it out.
Class is now in session at Elevate You, helping you discover your next level.
So the heat versus ice question, and this is one we get asked very frequently in our office, and there is a ton of information out there. So let me try to distill this down and give you the best possible recommendations I can give you based on my 15 plus years of helping people in my office. Ice is best used for short-term or acute type pain. So sudden onsets and sudden injuries is the best time to use ice, or any time that there's swelling. So a couple of examples. Let's say you're out for a hike and you roll your ankle, it hurts, it's swelling a little bit. That is absolutely one of the times you want to use ice. Additionally, let's say you've got pain and discomfort following an activity. So let's say you hit the links for 18 holes and you know what, I get home and my elbow's bothering me. Ice is probably the most appropriate thing to use in that situation, okay? And best instructions for icing, you want to place an ice pack on the area of pain and discomfort or swelling for 20 minutes. Take it off for at least 40 minutes and repeat as much as you would like. One tip here is with ice and icing pads, you want to make sure that there's always a layer of cloth, so wrap the ice pack in like a towel or some type of cloth. Do not put it directly on your skin because nobody wants frostbite. So we'll just spare you that trouble right off the bat. Ice is most important in these injuries for at least the first 72 hours after that injury. You can find even data or kind of thoughts online that say even for the first 2 weeks to even 6 weeks after an injury, you really should be focused exclusively on icing. I think, no disrespect to the organization that put that information out there, I think 6 weeks is probably borderline overkill before you would maybe want to mix in some other heat or other types of things. But I would say, probably fair to say for that first 72 hours, the first 2 weeks, depending on the severity and aggravation level of the injury, would be a great time to be using ice exclusively and not concerning yourselves with heat. So on the flip side, let's talk about an appropriate use of heat. Heat is best used for chronic or long-term type problems. Best possible example would be the pain, stiffness associated with arthritis or that abnormal kind of wear and tear and degradation of the joints. That usual pain is waking up in the morning feeling sore, stiff, achy, and that not really relieving until you get up and start moving around. Heat can be really, really great for this actually because it helps kind of loosen the muscles and helps create some relaxation. Heat, however, used in like these acute or short-term type injuries can actually complicate the problem by increasing the swelling and increasing the inflammation. As we talked about with the ice, certainly during that first 72 hours, so you've got a short-term problem that has just come on, we really want to be focusing on ice. If you're considering using heat, I would strongly suggest you test it first. And the way to test it is to actually apply heat, whether that's a heating pad, warm shower, soak, whatever you want to do, for up to about 20 minutes. See how your body responds afterwards for the next probably half hour to about hour and a half, 2 hours. If you notice that the pain is increasing, the swelling is increasing, you feel stiffer afterwards, then heat is probably not something that you want to continue using. Time to shift back to the ice and focus on that exclusively, okay? So, best possible advice I can give you based on kind of everything we know is that if you've got pain and discomfort and you want to do something in terms of self-care, start with ice first. Ice, in some ways, can't really aggravate or hurt the problem, but heat sometimes can. So, in the essence of safety or effectiveness, start with ice first. Test heat, see how your body responds. If your body responds okay to it, then it would certainly be okay to continue using it. If it doesn't, then flip right back to using ice. We really hope that you enjoyed this video, and I hope it helped simplify the confusion that can be around whether I heat or whether I ice based on the pain and discomfort that I'm having. If you're running into problems though that your self-care methods are not really getting you the resolution that you're looking for, we'd welcome the opportunity to help you discover your next level. Please call our office at 515-292-4988 and we'll see if we can help. Thanks so much.
Elev8 Chiropractic. Your next level awaits.